The surgery itself can take anywhere between 45 minutes and up to 3 hours, just depending on the complexity of the surgery.
It's totally not necessary to take out your teeth before the procedure. In fact, it's much more advantageous to leave your teeth until the day of the surgery, which helps in planning and issuing your final teeth.
We have general anaesthetic facilities set up, which enables us to perform the surgery in an environment that the dentist is familiar, and then we can undertake the treatment under general anaesthetic while the patients are asleep within the dental setting.
Patients definitely get a lot of swelling, but a common recurring theme is when they come back holding a full bag of painkillers, saying that they didn't need these.
With the All-on-4 Plus procedure, we provide 12 teeth. That is what you need for function and for ultimate aesthetics.
The initial healing phase of swelling and so forth is about a week, but the true biological healing phase, we allow 3 to 4 months.
The All-on-4 Plus implant system is very comfortable to wear because the teeth are fixed. And if the implants are positioned correctly, it's also they're also quite narrow, and the shape of them is very comfortable to wear. But the main comfort comes from the fact that they're fixed; they're not moving around in your mouth.
The All-on-4 Plus teeth look exceptionally real. We use natural tooth files and particular smile design to try and get the perfect shape and perfect sizing for each individual patient.
So the implants themselves are permanent, but the teeth themselves do undergo a wear and tear process, and they can, on average, they can last 5 years. We have patients who have them in the mouth for 15 years and even longer, but on average you would expect the actual teeth themselves to undergo some level of wear after about 5 years.
Certainly if your dentist is trained and understand the hygiene protocols, you can certainly go back to your own dentist.